select the pelvis protocols. And now localizer is running. I have changed the view from the view option. The localizer scan is running for pelvis. Localizer has finished, and you can see that three localizer images, sagittal, coronal, and axial, have appeared in the exam box. Now I am planning for the T2 sagittal protocol. For this, I have to plan on the coronal and axial image. By changing the coronal image, I make sure that the plan is at the mid sagittal plane in the pelvis. And after the planning, click the tick button. And now T2 coronal protocol open for planning. So I am planning straight to the pelvis. And also I find the uterus so that the slices are perpendicular to the uterus in the sagittal plane. If you satisfy, then click the tick button or apply. Now the T2 team coronal open. I just copied the plan from the T2 coronal and click apply. Now the T2 sagittal scan has complete, and I got the T2 sagittal image. And the uterus is seen here. So I am planning on the uterus for T2 coronal and also decreasing the slice thickness to 4 millimeter. And on the sagittal image, I am planning for coronal, and the slices are perpendicular to the uterus. You can see by changing the image, I make sure that the whole uterus is covered, and you can see an ovarian cyst maybe in the sagittal image. So I applied the T2 coronal, and then T2 team coronal open, and I just copied the plan from the T2 coronal for T2 team coronal. You can see that the plan has copied, and after satisfying the planning, I click apply. I'm deleting the T1 coronal, no need for T1 coronal. We don't take T1 coronal here. And now I'm planning for axial images. For this, I take axials in the first box, and then sagittal, and then coronal. I'm opening T2 team trap and planning on the sagittal image parallel to the uterus. I'm making sure that the slices are parallel to the uterus, and also on the coronal image, I'm making sure that the slices are parallel to the hip joints or pelvis, so that the slices cover the anatomy on both sides, the same anatomy on the both sides. So just adjusting the slices and changing the images, and make sure that the whole ovary, uterus, and the vagina is included in the slices. So after completing, click apply. And for rest of the axial plan protocols, just copy the planning from the T2 team chart. So right now I am planning the T2 team chart. So at first I plan the T2 TAC chart. So now T1 chart is opening and I copy it from the T2 chart. So also there is a diffusion protocol. So for diffusion protocol, I just copied the planning from the axial protocols. So all the normal sequence have been planned and only the contrast protocols are remaining to plan. So now let's make the films that sequences are completed. So this is T2 sagittal image, the first sequence I take, and this is the uterus. You can see, and also a cyst over the uterus. I'm trying to see the anatomies by changing the images, select series and send it to the filming, and then select the whole film and make 5 into 5, 25 section, and slightly adjust the images so that it fitted in the segment. I take time when filming and adjust the window also. So make it perfect, not so bright and not so dark. And this is a 5 into 5 format film. That means 25 slices is covered here. So make sure that all the segments have the patient information. And this is T2 coronal. So I'm changing the image and making sure that the anatomies are visualized. Select the series and send it to the filming. And select 4 into 7. That means 28 slices. Adjust the window when it's perfect to make sure that the window and the contrast is perfect in the film, and also the zoom pan and print. So this is a T2 STR coronal or team coronal. In Siemens MRI, STR is called as team. Select the series and send it to the film. Again, I'm selecting the series and send it to the film. And select the folder. Select 4 into 7. That means 28 segment in the film. So delete the extra images so that there is only one film remaining. And now adjust the window contrast and the zoom pan. And print out the film. So I have already printed three films. One is T2 sagittal, one is T2 coronal, and one is T2 team coronal. Now I am printing the axial image. This is the T2 axial. For T2 axial, I have select the 4 into 7 layout. Four into seven gives a 28 segment in the film, and there is one reference image. So adjust the contrast and zoom pan the images so that it fitted perfectly in the film. I always take time in windowing, changing the contrast. As long as I am not satisfied, I keep changing the contrast always. While it gets perfect, I print out the film. So don't cut out the upper abdominal wall. It's very important. And now T2 STR transverse. Select the series and send it to the filming. This is the reference image of the transverse protocol. And in the filming, select the folder and select the 4 into 7 layout and delete some extra images. And then slightly zoom pan and adjust the contrast so that it fits perfectly in the segments. And also adjust the reference image and make sure that the patient's information is in all the segments. And now this is T1 transverse and the diffusion scan is running. So let's select the T1 transverse and send this series to the filming. You can see that the urine in the bladder is dark because of this is T1 sequence. You know that the urine or any fluid is dark in T1. And also send the reference image to the filming, and in the filming delete some extra images so that 28 images including reference image is fit into the 4 into 7 layout film. And then adjust the images and adjust the window by zoom panning and changing the contrast of this image as perfect. So make the images not so bright and not so dark. Keep it in medium contrast and print the films. And now you can see that the diffusion scan is running. And after that, the contrast protocols are here: T1 transverse, T1 sagittal facet, and then T1 coronal facet. So this is the diffusion weighted image. There is a series of images according to the B values. There is B, this is B1000 value. I will print this and select the series and send it to the filming, and also send the reference image to the film. And this is also in the 4 into 7 layout. Select the 4 into 7 and delete some extra images so that the extra images are deleted and only one film remains. There is two films right now. So I will delete 3 images from the series so that there is one film remaining. And now zoom pan and adjust the window. And also adjust the reference image. Again, I am changing the contrast. I always take time here. I don't know why I am not satisfied quickly in the contrast, the concern of the contrast, and I printed out. And now all the normal sequence have been done, and now it's time for give contrast. So I will move out the patient to give contrast to him, sorry, to her, because this is a female patient. So I'm copying the protocol from the T1 axial for the post contrast T1 axial. And I also make it fat set and rename it as a T1 tra fat set because I change the contrast in the parameters. Make sure that this protocol is fat saturated. Fat saturated images are well shown in the after post contrast images. You can see that the slice block is showing uh, orange color, and I'm changing the positioning mode and it turns yellow. So this is the technique. If you see any red signal in the plant, just change the positioning mode to ISO. Because in the positioning mode, if the positioning mode is in the fixed mode, then the table will be fixed, and if you change the slice, the table will not move as you desire. Now I have planned the sagittal protocol, and now I am planning the P1 coronal head set. For this, I'm planning on the sagittal image and reducing the field of view to 300. So that is a high resolution image I get, and click apply. And now the post contrast protocols are running. And I'm checking the how much pins I printed. So T1 axial fat set and T1 central fat set has complete. And this is the T1 axial fat set post contrast. To film this, select the series and send it to the filming. And also select the reference image and send it. And now select the folder and layout. From the layout, select 4 into 7. And there is 3 extra images, so delete 3 images so that there is only 1 frame remaining. And from the properties, remove the reference image from all the segments, and now drag and zoom pen to adjust the images perfectly, and also adjust the reference image and print out. So now this is a T1 sagittal fat set post contrast. Select series and send it to the filming. And also send the reference image. Now select the folder, and from layout select 5 into 5. That means the 25 images have been placed here, and adjust the images by zoom panning and changing the contrast, and then print out. And now T1 coronal fat cell, the last sequence is running, and it's just finished. And move out the patient and take him down. The scan has completed all the scans. And now check the T1 coronal fat cell and select the series and send it to the filming to print, and also the reference image for the coronal sequence, send it, and go to filming and select folder. Adjust the reference image, and from layout select 5 into 5, and there is extra images, and I have changed the layout to 5 into 6 so that 30 images are set here in the film. So adjust the window, and keep the reference image for coronal image and print out. So that's complete, and close the patient from the patient option, and the scan is complete. So thank you all.